Hello, and thanks so much for joining us today. We're going to be talking about a topic that I think affects a lot of people. It has to do with our gut, our gastrointestinal tract, and diseases and symptoms and conditions that many of us experience on a fairly regular basis. And we're going to talk to Dr. Frank about how CBD could potentially help. But first, let's understand what these conditions and diseases are, and that's why we tend to call on Dr. Frank to sort it all out for us. Good morning, Dr. Frank.
Good morning, Stacey. Thank you for having me today.
So let's talk about the gut. Let's talk about some of the conditions that and symptoms and diseases that we tend to get on a regular basis, and let's break it all down. So what is a gastrointestinal disorder?
Yeah, of course. And that's such a great question to start with. As a holistic practitioner, as a functional medicine practitioner, I think this is one of the most overlooked conditions, right? Our gut is connected to almost all aspects of our health, as is gastrointestinal disorders, gastrointestinal distress, or GI distress for abbreviation. So when we're talking about GI distress, there's really two main categories of conditions, okay? The first category would be inflammatory bowel diseases. So these are inflammatory conditions. And then you have irritable bowel disease or irritable bowel distress, okay? So this could qualify as anything. This could be as simple as gas, bloating, constipation, diarrhea, the day-to-day stuff that no one wants to talk about that I think so many people deal with. Or we could be talking about something more serious, like a Crohn's disease or a celiac disease, something that's autoimmune driven in nature in the gut, something that's creating an immune system reaction. So when we're looking at this blanket term of GI distress, we're talking about something as simple as you ate a bad meal, you had a bad salad, and now you're bloated and you have gas, all the way up to the Crohn's disease, which can result in bone loss, bleeding disorders, and very, very serious side effects. But they all fall under this general umbrella of gastrointestinal disease.
So that I always think of inflammation, right? Because of course I'm focused on CBD, and I've always been told by practitioners like yourself that inflammation is the root cause of disease. And so it's always about discovering what causes that inflammation. So of course, as a functional medicine practitioner, you're always looking at the root cause, at what is causing something, right? So do you focus on when you're looking to help somebody who is complaining of GI issues?
That's great. So yeah, let's attack that. So let's take that first category of inflammatory diseases that I mentioned, IBD, inflammatory bowel disease. So for any of our listeners, if you suffer from a Crohn's disease, or if you suffer from colitis, ulcerative colitis, this is an inflammation of the colon, okay? The colon is part of your gastrointestinal tract. So when we're dealing with patients or when we're advising on nutrition for these patients or supplementation, our goal is to decrease inflammation and decrease that autoimmune system response. Now, for those listeners who have been thinking, oh, maybe I do have something like this, well, first think of your symptoms. If you suffer day to day from abdominal pain, gas, bloating, perhaps even like rectal bleeding, things along those lines, some more obscure things, bone loss and osteoporosis is a common side effect of Crohn's disease and colitis due to lack of proper absorption of nutrients. You would be in that category of an inflammatory condition, okay? And that inflammatory condition is usually the result of an overactive immune system. So what happens is, let's say you start off and you wind up, let's say you got some virus infection, okay? And your body was trying to fight this virus or bacteria. Well, what happens? Your immune system turns on and it starts to attack that bacteria in your body. But sometimes your immune system will mistake its own organs, in the case of inflammatory bowel diseases, your own colon, the tissues in your own colon, as invaders, and it will start to attack your body's own systems. This is an inflammatory bowel disease. Now, the gut regulates all our health. This is where we have our healthy gut bacteria that play such an important role in brain function and in our energy levels, in our mood. They're doing massive studies on this when it comes to depression and anxiety. So, when we see these patients that come in with inflammatory bowel diseases, a diagnosed Crohn's or a diagnosed colitis, my immediate thought is let's decrease that inflammation. So where do we start? Of course, we want to focus on an anti-inflammatory diet, right? We start to get rid of the processed grains, the processed carbohydrates. We try and remove the rancid omega-9 fatty acids and bring in more healthy anti-inflammatory omega-3 fatty acids. And then, which we'll be talking about a little bit later on, CBD in my offices, and I think if you talk to most functional medicine or holistic practitioners, is something that we're finding can be a huge benefit to these individuals, not only from helping with some of the symptoms, such as perhaps an osteoporosis or fatigue or insomnia or anxiety, but it actually also helps to quiet down that inflammation within the gut as well, within the colon as well. Now, that's for our inflammatory bowel diseases. Not necessarily, a little different is our irritable bowel diseases.
So what is that? What's the difference when you say, because a lot of people use the IBS term pretty loosely. So what is that, and when do you know if you have it?
That's a great question. So a lot of people, I think they leave the doctor's office, they go in, they wake up, they have this stomach discomfort, some gas, some bloating, constipation, whatever it may be. And they go in and they're diagnosed with IBS. So IBS is a non-autoimmune disease that causes gas, bloating, constipation. It can certainly cause depression and anxiety. If you know anyone who's ever had to deal with going to the bathroom constantly, it's a fear that these people have. 1 in 6 Americans will actually suffer from IBS, irritable bowel syndrome, at one point in their lives. Now, these people, this condition is not driven by an autoimmune response like in a Crohn's disease where the body's attacking itself. This is more the case of we ate bad food that didn't agree with us. Now, some other things that they're really putting a lot of attention to studying when it comes to IBS is that gut-brain connection. So have you ever said, oh, I have a bad gut feeling about this, or I have a good gut feeling about this? That's a very real connection between your brain and your gut. Your gut actually contains, I want to say it's about 80% of the amount of neurotransmitters that are found in your brain. And these two parts communicate to one another, your gut and your brain. So they're studying the effects of stress on IBS. If someone's under a lot of stress and they're eating super healthy and they're taking probiotics and they're doing all these things, but their gut isn't getting any better, they may want to consider that stress being a cause. Another common cause outside of the foods that we eat is actually hormonal changes, especially when it comes to females. Hormonal fluctuations or hormonal imbalances can also result in irritable bowel symptoms or IBS syndrome. So again, we look at the gut-brain connection, we're looking at hormonal changes, and we're looking at our lifestyle habits, the foods that we consume, our exercise habits, anything along those lines. Not necessarily an autoimmune driven disease like irritable bowel diseases.
So you have IBD,
Yeah.
irritable bowel diseases, and then IBS, irritable bowel symptoms.
Yeah, and I said, yeah, and what Stacey, I said that. Yes, you're correct. You have IBD, and IBD is inflammatory bowel diseases. I don't want to mix that up.
Inflammatory. Okay,
That's
did
the big
I?
difference.
Okay, did we? So we've got that clear. But then you
Yeah,
can have some things in between, right? That maybe you went out to dinner, you ate a steak that was very high in fat, and maybe you don't eat that very often. You come home and you notice that you have some gut reaction, right?
absolutely.
So I think you've really covered the spectrum where we can have something that's happens every once in a while based on maybe food you eat or a circumstance in your life that's causing you a lot of stress, that you can have that gut reaction. And then you have more serious diseases and conditions, and it all stems from what's going on with our gut. It's all stemming from inflammation. And in some cases, it's actually a disease. So when can CBD help with these different, the three areas that we've addressed?
Of course. So we'll CBD benefits each one pretty similarly. So I don't need to go into too much of the difference. I guess when you're talking about inflammatory bowel diseases like Crohn's and ulcerative colitis and these immune system driven ones, I would encourage people to watch our podcast on autoimmune disease, because that really goes into detail and you could relate that to any autoimmune disease. But we know that CBD helps to balance out the immune system. Now, more specifically, just in general for the GI system, in your GI tract, okay, your body has many, many, many CB2 receptors. Now, something to keep in mind, your body makes its own cannabinoids. These cannabinoids bind to these receptors in your GI system, and your endocannabinoid system plays a close role in regulating bloating, gas, constipation, bowel regularity, okay? All these different things. So by activating these receptors in our gut, we can aim to normalize our bowel movements. We can aim to try and attack bloating. I think this is one of the reasons we see so many women, believe it or not, who suffer from PMS and they have all that bloating and they're saying, I didn't eat a thing today. It's probably more the hormonal imbalances than it is really what they're eating. And we see CBD provide them with huge benefit. So that's one area. You have the CB2 receptors in the lining of the GI tract. CBD oil indirectly affects those receptors, turns on our endocannabinoid system, and we see this balance occur. Now, the other big thing, I think I say this in every podcast because it comes up over and over again, when they actually looked at mice, when I believe some studies were actually done with humans too who were suffering from colitis, they found that they had increased levels of an enzyme that destroyed the body's own cannabinoids. And when you take CBD oil, it blocks that enzyme, allowing your body to produce more of its own cannabinoids naturally. And they found that these people were also getting relief from GI distress. And that was one of the other proposed mechanisms. Now, I don't have in-depth details, but there's a lot of interest right now in how CBD affects the brain and what that can translate over to the gut. So for example, if we've done podcasts on anxiety and PTSD, someone's suffering from PTSD, at least we see this all the time, especially with our chronic pain patients, they usually have GI issues as well. Well, if we can affect that PTSD by using CBD oil and affecting how the brain is registering those adverse memories, are we then positively impacting the gut by impacting the brain on top of stimulating the endocannabinoid system in the gut as well? In my opinion, absolutely. And this, we see great results with this every day. So you have a few different ways that CBD oil is playing a role. It has a direct effect on the CB2 receptors in the gut. It affects that enzyme that's eating up our body's own cannabinoids. It quiets that enzyme down. And then it also impacts our brain function in a very positive way to almost allow for a clear communication between our brain and our gut when it comes to those neurotransmitters. So you're getting like a triple whammy on this one when it comes to benefit.
It's really interesting because we always talk about how everything's so interconnected, right? I mean, CBD has been proven to help with nausea. It's also been able to help with appetite. We've had people tell us that they've actually lost weight. We certainly don't promote it that way, but balancing appetite, helping people, give people an appetite. So there is a gut connection with CBD, and we're learning. There's so much we don't know, but we're also learning more and more as we understand how this plant extract works. But one of the things that I've read about the endocannabinoid system is it actually helps regulate appetite, and regulate digestion, which means it's all connected, right? It's all stemming from our gut.
That to me makes complete sense. It's stemming from the gut. And I think so much of it, you said you've seen people use it to lose weight even, right? We've seen the same things. I noticed if people were overeating, it seemed to help them lose weight. If people were under eating, and they have research on this now, like anorexia and things along those lines, it can help these individuals gain weight. So the question becomes, why is this? And I think a lot of it has to do, when you look at the science between anorexia and obesity, they're not that different of diseases. They're just on opposite ends of the spectrum. And CBD seems to benefit both. Why is that? I think a lot of it has to do with that gut-brain connection.
That is so fantastic. That's so interesting. And that's why functional medicine is actually becoming more popular, right? And people are not popular as a trend, but people are becoming more educated that, you know, remember that song when we were kids, the hip bones connected to the,
Oh yes,
all,
yeah.
it's really telling us that everything is connected. If you have one symptom, it it could be caused by something else. You know, it's like really, you know, following the rabbit trail.
Think about this approach. Let's say we're dealing with an individual, a female who has osteoporosis. She's postmenopausal and she has gut issues. She goes to see her physician. Of course, we have excellent physicians out there. I'm just giving something that I've seen before. And the physician says, well, listen, you're postmenopausal, you know, the digestive tract changes and osteoporosis happens. But she keeps saying, oh my gosh, my gut, I'm bloated. Something's wrong. Something's wrong. It gets brushed off. Take a Tums, take a Imodium, whatever. Now, what isn't it much better, instead of just saying, okay, she has IBS and it's postmenopause, to say, well, wait a minute. What if her osteoporosis is tied to these hormonal changes? And what if her gut is also tied to these hormonal changes? And what if we can start to treat the gut? How is that going to then impact her hormonal levels and perhaps the osteoporosis? It's a much more comprehensive point of view than just saying, oh, you have osteoporosis because you're this age and you have IBS because people have IBS. It's much more comprehensive, in my opinion, to take that approach of digging deeper. And like you said, everything is connected. This is not a bunch of separate moving pieces.
It's awesome. I love it. We could do a podcast just on that. But and that's, you know, the thing that the benefit that cannabis provides us, primarily CBD and the rest of the cannabinoids, excluding THC, is providing us that balance. So if whatever is out of whack, CBD can help bring it back into balance. You know, it's not the miracle cure all, but it is assisting people with conditions. And today we're talking about the gut. So the other thing I think is really, really fascinating is it's a tool that can help bring everything together. So, you know, maybe you could talk about how CBD is not, again, not the end all be all, but if you're trying to find balance, if you have gut issues, maybe it's talking about the food that you're eating and then also incorporating the CBD. It's part of a regimen of change and getting to the root cause of the problem.
Yes, you are 100% correct. And I can give people, you know, $1 million advice right here. If you have gut issues, absolutely listen, especially if it's something new. Go get diagnosed. Make sure there's not something weird going on, right? Unfortunately, tumors happen, autoimmune diseases happen. Go make sure it's not something more serious. But once you come back with that diagnosis of IBD or IBS, this is what you can do. One, change your nutrition, change your nutritional habits, right? Think about it. Your colon has to work so hard to process everything you put into it. If you're eating McDonald's and drinking, you know, Pepsi and then having beer at night and pizza the next day, your colon's working in overtime, right? So that's a problem for most people, right? It's never going to be able to keep up with those toxins. So get rid of the processed carbohydrates, get rid of the processed fats. Start looking into a healthy gut anti-inflammatory diet. There's amazing books out there. I'll put links for them for you guys, okay? That's advice number one. Step number two, so many people say, oh, I'm bloated in the morning. I don't want to eat breakfast. Here's a tip for you. Don't eat breakfast. Fast for breakfast. And I got another tip. Go exercise in the morning. Go do 20 minutes of light cardio or go for a walk. I know how discouraging it is to wake up and have your stomach hurt. You don't want to get out of bed. You're thinking, how am I going to get through the day? Go move for 20 minutes, whether it's a walk, an elliptical, whatever it is. I cannot tell you the number of patients that come back just by doing those two simple things, fasting and exercising in the morning, say, oh my gosh, that morning bloat, that morning discomfort, it's gone. You can also fast for dinner. It's a little more complex, but it's doable. Now, so what are you going to do? You're going to change your diet. You're going to start exercising. And then Yes, of course. There's supplements out there like turmeric and cissus and probiotics, and those are all great things. Where do we start with people in my offices? With CBD oil. Because if this person's hopped up and they're anxious all day long, if they do have maybe some osteoporosis because it's a postmenopausal, female, I know CBD is going to work on each of those things as compared to throwing 10 different supplements at them right off the bat. It's an easy 3-step process. Exercise, change your nutrition, integrate CBD, and I think some amazing things could happen for people just by doing those 3 things, and that's not asking a lot.
So we've talked about the gut. We've talked about sometimes it's disease, sometimes it's syndrome or a symptom. So how do you recommend? I mean, those are 3 different areas. So of course, we always like to give people a little bit of guidance if they're taking CBD. Where do they start and how do they start?
Yep, that's a great question. So this is one of those ones too where I would advise people to be aware. CBD is biphasic. What does that mean? At too low of a dose, it might not work for you at all. At too high of a dose, it might have the opposite effects. So if someone's taking it for constipation or diarrhea, I would just caution, work your way up slowly. I have had, an instance here or there where someone said, actually, I was taking it for diarrhea and it made me go more. My response, that's great. We know it's impacting your GI system. We just need to cut it back. We were probably on the wrong side of that bell curve, okay? So what we advise people to do is we usually start them off pretty low, somewhere between 5 to 10 milligrams a day. And then we have them just work their way up in increments. So 5 milligrams a day the first day, 5 milligrams extra the second day, 5 milligrams again the third day. Most people usually land around 40 to I'd say like 140 milligrams a day. I've seen literature going upwards of 400 milligrams a day for gastrointestinal issues. Yes, you can go that high. No, you're not going to overdose. But at that point, if you're taking more than 400 milligrams a day and you're not seeing a result of any sort, I go back to the drawing board. So really, it's anywhere between 5 milligrams a day up to 400. Work slow. In our offices, we like to start at 5 milligrams a day, then 10 milligrams, then 15, then 20, until we find that sweet spot where that person is saying, hey, you know what? I slept better. I was less anxious today. And what do you know? I'm not having that normal GI discomfort that I always have.
That's great. Well, it's interesting to hear you say 5 milligrams. That's really a low amount.
It,
Are you having some people that are finding results with that little amount?
so it's very rarely. It's usually when we get into, I would say, that 20 to 40 milligram range is where we start to see the results more so. Maybe someone who's been using it long term. We do have a lot of people who may drop down to 5 to 10 milligrams a day for like maintenance purposes. But no, initially most people are probably needing 20, 40 milligrams a day. It's hard to say, but I do start people low, especially if they are dealing with like diarrhea or something that's a little more urgent, just because if we catch the flip side of that bell curve and they say, hey, I think it made things worse. Again, my response is, okay, great. It impacted you, but we want you to take less in this case.
I see.
Yeah. And 5 milligrams for us, you know what, Stacey? It's a very easy number to work with, especially if we're using the 3,500 milligram bottle. I'm pretty sure per drop, it's 5 milligrams. I think that's a safe number to say. So for us, that's really easy for me to say, okay, how many drops did you take today? Oh, I took 3 drops and I felt great. Great. You were at 15 milligrams. Now for any concentration, any liquid, we know it's 15 milligrams. Most people can think very easily in terms of 5 milligrams. And I would say that's more why we adopted it than anything. If I'm being more aggressive, I probably start someone off at 20 milligrams split up twice a day, so morning and evening. But yeah, for most people, just for simplicity purposes, I think we adopted that.
Well, and I think it's, everybody's different. Some people's comfort level. The first time I did it, I took a half a dropper and was just like, okay, let's see how I feel. And,
That's
it depends on the individual. It's not going to hurt you. I tell people all the time, you could drink the entire bottle. You'll be fine.
Yeah.
It may upset your stomach a little
Yeah,
bit,
you might get a little, yeah, sure.
having an irritable bowel response, but it's not going to hurt you, right? So, but we always tell people start low and slow. It kind of gives you an idea of seeing how you're affected. It's interesting because a lot of people, we're so used to taking something and getting an immediate, we know we took something, right? You take a shot of whiskey, you know you took a shot of whiskey. If you take a medicine to help you sleep, it puts you to sleep. CBD is a little bit more subtle, and it's the first thing that I've really been exposed to, because I don't take any medications. The first thing that I've been exposed to that takes a little bit to get to know it, and it takes a little bit to understand how it affects you, because it is not a one size fits all. And that's what's really unique. Sometimes people tell us, I didn't realize how much it was helping me until I stopped taking it. And then we have people that call and say, my auto ship didn't arrive today, oh my gosh, I need it. And we're thinking, my gosh, we're not heart surgeons, this is
Yeah.
not something that's keeping you alive necessarily. But it's because when we know what it does for us, we depend on it, and when it works, right?
Yeah, why would you get rid of something that's working so well? And I love, that's a great point too. If you think of medications that do work so fast, right? Someone takes an Ambien and they're knocked out. Well, look at the litany of side effects that come with that. I want people to think about what is happening. Think about inflammatory bowel disease. This happens over years. Most people don't, yes, you do have a case where someone had a virus and they got it, but most people, this builds up over years and years and years. So if you're going to take a medication that's going to reverse those symptoms overnight, of course it's going to come with some harsh side effects because it's dramatically impacting your immune system. I love that CBD is more of an experiment because you're working with your body versus forcing it into a state, into a change that it might not have been ready for. So I really think that's one of the main benefits about CBD. And I'm sure you agree based on how you're talking that I love that it takes time to figure out that dosage, because anything that happens really fast, anything that's an impulse, usually doesn't work out too great at the end of the day.
Right. It's about tuning into your own body. And I've had people sit across at my desk and, we'll be having a conversation and they'll say, you know what, I feel my pain is less. That little crick I had on my neck is not really there. But again, it's very subtle, and it's not causing a bunch of other issues. And, sometimes it happens where somebody says, I was taking CBD for pain, and what I noticed more than anything is that it helped me get a good night's sleep. So again, it's about understanding what CBD can do for you. And here's another thing to add even more to the interest and intrigue of CBD. You may take a certain amount of CBD for sleep, and then you may take a different amount for anxiety. Maybe you have anxiety throughout the day. I know somebody that takes just a couple drops to be able to cope throughout the day.
Mm-hmm.
But then for sleep, she takes half a dropper. So once you understand how it works for you, once you understand that it's not going to hurt you, then your confidence is there, and you can really experiment and really fall in love with this extract, because it really is doing amazing things and has great potential for so many different ailments and conditions that we deal with on a daily basis.
I couldn't agree more. That is well said.
Awesome. Anything else that you feel like we need to touch on in this subject before we call it a day?
No, I think we covered most of it. I tell people follow up with the blog posts that you guys put up. I have some bonus information in there. Again, books, other health and wellness stuff that can get people on the right track. And that's it. If you haven't checked out CBD, I'd really look into CBD BioCare. This is a great product you guys have. That's why we keep doing this every week. That's why I keep coming back. Okay, it's not because it doesn't work, right? So there you go.
Thanks, Dr. Frank. Appreciate you.
Anytime. Bye now.